There are thousands of these facilities across the country, and a precise reading on the toll that coronavirus has exacted in them is elusive. That's because many states have delayed or withheld critical data on this topic. But the estimates suggest that of all the coronavirus deaths in this country, up to 1 out of every 3 come from nursing homes and other long-term care facilities. Again, exact numbers are hard to pin down here, but nationally, the Centers for Medicare and Medicaid Services, that's the federal agency that oversees nursing homes, it has failed to tally, in the words of an NBC News report, the number of nursing homes that have had outbreaks nationwide or the number of residents who have died, obscuring the true toll the virus is taking. An independent analysis from the Washington Post found, quote, a nationwide list of more than 1,300 nursing homes with a death count that has spiraled into the thousands. In some states, according to reports, deaths in nursing homes account for half of all COVID-19 deaths. And the nursing home industry is still having to plead for greater access to testing and protective equipment. And for more, I am joined by Mark Parkinson, CEO of the American Healthcare Association. That represents thousands of assisted living and long-term care facilities. And Debbie Senzipper, a Washington Post investigative reporter who has covered the coronavirus outbreak in nursing homes extensively. Debbie, let me start with you. We mentioned we don't have an exact count here on numbers, but they're staggering. I think we all see the headlines. I think we all understand you've got an incredibly vulnerable population living in tight proximity to each other, so you can just see the setup there for a disaster. I think the question is, when you look at what has happened, where does the failure lie on this? Is it a failure on the government's part here to work with these nursing homes, to provide them with what they need? Is it a failure of the nursing homes themselves? What are you finding in your reporting?
Yeah, great question. I don't think anybody could have predicted just how bad things would get in nursing homes. Not the nursing homes themselves, not the governments, not the families. But as you said, and as we now know, so many thousands of nursing homes and other long-term care facilities have been decimated by this virus. The death toll is staggering and horrific. And I think many nursing homes, according to watchdog groups and patient advocates, did everything possible and are trying to do everything possible to control the spread of this virus. But there were some issues with nursing homes that have had track records of failing to prevent the spread of infections. And those were infractions that were cited by federal inspectors year after year. And were cited right up until the months before this pandemic struck.
Let me bring you, Governor, your former governor of Kansas. I want to bring you in and give you your proper title there. But let me bring you in now. You now represent these facilities that we are talking about. And the point Debbie just made, there are a lot of cases here when this is not, any kind of negligence on the case of the facilities. But what she's mentioning here is there are facilities with a history of violations that were still operating in spite of that and where this was a particular issue. How big of a problem do you think that is in the industry that you represent?
Yeah, well, the real challenge here is that COVID is actually not related to prior inspection history or prior infection control problems, and that's because COVID violates all the normal principles of infection control. That is because folks can have the virus with showing no symptoms. So what happened in January, February, and March were that hundreds of thousands of people, maybe millions in the United States, had COVID with no symptoms. They were and continue to work in buildings. They were visiting buildings. Some of them are residents themselves who are asymptomatic. And so the spread was really inevitable. That's why I think it's not surprising that when you compare buildings that have it to those that don't, there actually isn't a difference based on inspections or infection control history. It's all connected to the community that they're in. There's a bunch of COVID in the community, you're going to have COVID in the nursing homes. And that's why my message tonight is to the governors. If you open up too early, and if folks are out there getting COVID in the community, one of the ramifications will be that it will find its way into nursing homes and more people will die. So I think the real policy prescription here is, of course, we need to make sure that every facility is practicing perfect infection control, but that wouldn't have stopped this. The only way to stop it now is to keep COVID out of the community and then also to get a ton of testing in the building so that we can figure out who actually has it.
Debbie, let me ask you, what practical steps here are being taken and have proven effective to keep this out of nursing homes? I know in New York State that the governor there announced some new restrictions. There's going to be testing now of residents. There's restrictions on who can be coming in and out of these things. Is there anything out there that's proven very effective at keeping this out?
Yeah, I don't think we'll ever really know if better infection control would have prevented the spread of this virus. But what state inspectors have found in homes with outbreaks is that they lacked personal protective equipment. There was poor hand hygiene. They weren't washing hands. In some cases, patients with symptoms were not isolated from patients who appeared to be healthy. And state inspectors have found issues. And in fact, there's a nursing home in Maryland now that was just fined $10,000 a day because of infection control breakdowns. So I think, a number of things could help. Good infection control, personal protective equipment, more staffing. Nurses and aides get sick. Who do they call in then as backup? So staffing, I think, is also a huge issue, and patient advocates and watchdog groups will tell you that.
Governor, let me ask you just a practical question here. To any family out there right now who has a loved one, an elderly loved one, who they had been thinking about or planning to put into some kind of assisted care facility, and they've got it on hold right now, can they realistically have confidence before there is a vaccine, before there is some kind of effective treatment for this? Can they realistically have confidence that it's okay to put an elderly family member into an assisted living facility?
Yeah, I mean, it is an enormous dilemma for families, and I completely get it. My wife and I, before politics, we owned and operated facilities, and I work with families and members and residents every single day. The residents need a lot of help. They don't just need a little bit of help. They're 85 years old. They have a ton of things that they can't do and that they need help with. But I completely understand that you don't want to put a loved one in a situation that you don't think is safe. The good news is that if we have what we need, once we get the equipment and once we get the testing that we need, we can safely take care of people. And I would encourage folks to talk to facilities, make sure they have COVID isolated wings, make sure they have the equipment they need, make sure they have the testing that they need. We need all of the above in order for this to work out. We have been denied that. The policy prescriptions of looking at surveys and all that, that's the wrong direction. The right direction is to give facilities what they need to fight this. And if we do, we can make this much better.
All right. Thank you to former Kansas Governor Mark Parkinson, now representing nursing homes and assisted living facilities across the country, and Debbie Senzipper, reporter